Good day everyone, my name is Anastasia Krasikova and I'm a student at US University. Today, June 13, 2025, we are here to meet our patient, gather a comprehensive history, health history. But before we start doing that, I wanted to show our location, that no other individuals are present. We're trying to focus on his past and current medical history, gather some information and document it in my notebook. Before we do that, let's ask his permission or consent to document the report and upload this video on YouTube for educational purposes. Are you agreeing, sir, to do so?
Yes.
Thank you. Could you please state your name, sir?
My name is Arthur A.
How old are you?
I'm 49 years old.
And when were you born?
My date of birth is February 11, 1976.
What is your race and ethnicity?
I'm white and I'm an Armenian ethnicity.
No gender change, yeah? You were born
No.
male. Okay. So, what brought you here? What are your concerns?
I came for a wellness check for my annual exam.
And I saw that you brought your labs, the most recent ones, yes, and your medication.
Yeah, I wanted to discuss my labs as well.
Thank you. We will do that shortly. But first, I wanted to focus on your past history to have a comprehensive picture of your health and your conditions. First, tell me when you had your physical examination with your primary doctor.
Last physical I had a few months ago.
And do you know your current diagnosis? Because you're on some medications, I see you've been treated.
I have diabetes and slightly elevated pressure, heart pressure.
Okay, so we'll focus on that as well. Do you have any allergies
No.
to latex, any environmental irritants?
No.
Do you smoke or use any tobacco?
No, I don't smoke.
How about drinking alcohol?
I'm not a regular drinker, no. Maybe a couple of times a month, socially.
When would you drink?
Well, some wine,
How many glasses?
like one or two.
Thank you. That's wonderful. How much coffee do you drink?
Like a cup a day.
A cup a day. That's good. That's actually what's recommended. Do you use any recreational or illicit drugs like marijuana or methamphetamine?
No. No drugs.
Where do you work?
Where do I work?
Yeah, what kind of occupancy?
I work at the office. It's a finance company, so I work at the office.
Are you sitting most of the day at the
Yeah.
computer?
I work in front of a computer.
Okay, so no hazardous materials involved.
No.
Thank you so much. Have you served in the military?
No.
How would you describe your life, your sleep patterns? Do you go to sleep on time? Do you sleep well? Do you get up at night? Wake up?
Yeah, I try to go to sleep, on time. I sleep well. I don't wake up at midnight, so I don't see any issue there.
So you don't use anything. You don't watch TV before
No.
you go to sleep. Nothing, right? Do you experience any significant stress in the sense of what's the stress level in your life? How would you estimate?
I guess normal. I don't have any stress level that I would think that's different from other people's stress levels, I would say.
And do you have family support? You're married?
Yes, I am married.
Do you have kids?
Yeah, I do have 3 kids.
3 kids. What are the ages?
16, 15, and 6.
6. So do you live in a house or apartment?
Yeah, I live in a house.
How do you feel at home? Safe? Any domestic abuse?
Yeah, I live in a good area, so it is safe.
No violence?
No violence, no.
From any family member?
No.
Okay. How do you like drive? Do you use seat belts?
I use seatbelt, yes.
Do you text while you're driving?
No, I don't text while I'm driving.
Oh, that's wonderful. How about guns? Do you own any guns?
No, I don't own a gun.
No guns. How about pool?
No, I don't have a gun.
No pool. Wonderful. So you mentioned that you're married and you have kids. So do you are you still sexually active?
Yes, I am.
Any contraception you use?
My wife uses contraception, yes.
Okay. So how's your any concerns about your libido and about your sexual performance? I'm sorry to ask these questions.
No,
Just-
I have no concerns.
No concerns. Any recent sexually transmitted diseases?
No,
We can test you for HIV or hepatitis B. It's actually recommended.
yeah, why not? I don't need any. I don't see any need for that. But if that's I have no objection of being tested.
Okay, we will consider that. Thank you so much. About your mood, your attitudes, did you notice any changes towards your friends, your families?
No, I don't see that changes. I'm pretty calm. I don't,
No anxiety.
no anxiety. No,
You haven't been diagnosed with depression?
no.
Mhm. I know that mental and emotional well-being is important as physical health. How about religion? Are you a religious person?
I'm not deeply religious now.
Okay. So, about your prior hospitalizations, do you have any in the past since your childhood?
I had one surgery when I was a child. I had an appendix removed.
Appendicitis.
Yeah, appendicitis removed.
How old were you?
I was about 10.
10 years old. Any other surgeries, any anesthesia reactions,
No.
if you remember? Are you up to date with your vaccinations?
Yes, I am.
Let me check. So looks like you had your measles, mumps, and rubella in 2003.
Okay.
Actually, in January 9th. We can check the titers, and you also had Tdap in August 2005, August 3 to be exact. It's recommended every 10 years if you consider that. Those diseases are dangerous. Even at your age, you can get it through the wound, for example, tetanus, and it can cause muscle spasms. It's pretty severe. It's pretty dangerous, disease. And if you consider that,
Okay, if it's recommended but not required, I don't want to take them.
okay. So, and I could see that you got varicella, chickenpox when you were very little, in 1979. So, we can also give you shingles vaccine for shingles.
Okay.
Pretty painful rashes, would be painful in the body. So if you would like, we can, give you some information about current vaccinations.
Sure.
Okay. Thank you. So when you had your physical examination with your primary doctor, did he mention any recommended any colonoscopy, any stress test, echocardiogram?
I had stress test like a year ago. When I went to my cardiologist, so I had stress test and I had echogram or whatever they call it. Echocardiogram, yeah. So there were no any issues.
No issues. Okay. So, do you recall any medical history of your parents? Are your mom and dad still alive?
Yeah, my mom and dad still alive, yes.
What diseases do they have?
My dad has diabetes, and he had a heart surgery. They changed some valves. They fixed the valve, and they put some stents in his heart.
It's pretty extensive. Maybe that's why doctor recommended echocardiogram to check your heart
Yeah.
and stress test. Wonderful. And what about your mom?
My mom, She's healthy. She has, I guess, pre-diabetes. Other than that, I don't know any other issues that my mom has.
Mhm. So, and your grandparents, they passed away?
Yes.
They passed away. Do you remember at what age?
My granddad passed away pretty early, at 58. He had a heart attack.
I'm sorry.
My other grandfather died at about 70. He had some issues with the drinking, so he has some liver problems.
Okay.
My one grandma from my mother's side died about 70. I don't know what she died from, but she didn't have any chronic illnesses. I don't remember her having any chronic illnesses.
Mhm.
My grandma from my father's side, she went to live over 70, 75. And again, I don't know any chronic illnesses for her.
Yeah, okay. I guess like overall your family's history included some heart issues and diabetes,
Yes.
right? Okay. So, did the doctor recommend any cancer screening? Because you're approaching 50s, recommended to have colonoscopy to check?
Yeah, they talk about colonoscopy, but I didn't have a chance to go do it. So.
Mm-hmm. We will discuss your diet and how it's related to cancer, risks for cancer later. I see that you're wearing glasses. Do you have regular eye exams?
Yeah, I do annual eye exam. Usually I go to the place that I buy glasses because they do it for free. When you buy glasses, the doctor actually look at your eyes and check.
So did you notice if it's get worse?
They didn't say nothing, so it's normal.
So you basically stay the same?
It is the same, yeah. They told me that my glasses and my farsightedness is age related, so they don't see any issues with that.
How about vaccinations, like annual flu shots? I didn't see it in the card, but do you have it? Sometimes they don't put it on the card.
I do take annual flu shots, just because I don't want to get sick. It's very convenient. Other
What
than
time
that,
of the year do you take it?
I think in November, September, November, that period.
How about COVID booster? Would you consider
I
that?
had COVID booster before, and now I'm not taking because it's not required. I don't see point of taking it.
Okay. So again, we can start with your eyes. We're gonna go through the review of systems, and we're gonna start like looking at the whole body and ask like, just general but specific to your body questions. Like for example, about your head. Do you have any headaches, any migraines in your life?
No, I don't.
Did you feel like your hearing is worse, or you have?
No, aside from diabetes, I don't have any concerns, any issues. I don't. Yeah.
How about sinus congestion or sore throat?
No.
Nothing like that. How about your throat? Any coughing, like repetitive coughing,
No.
shortness of breath?
I don't have those.
About your chest, any tightness, any pain, cough,
No, I'm fine.
wheezing? No.
No.
Okay. How about your stomach? Do you have any problems digesting food?
No.
Any nausea? Okay. Diarrhea? No, nothing, no discomfort?
No.
Okay. How about change of appetite?
Well, for diabetes, I'm taking Mounjaro, and it's kind of affect my appetite, so I eat less. Other than that, I don't see any major changes.
That's wonderful. That's the purpose of the medication. That's what we need. With kind of intentional loss, and we're aiming to lose the weight, right?
Yes.
Okay. About your elimination, any difficulties in peeing, like
No.
starving,
No.
burning, any bowel movements like constipation or diarrhea?
No.
Something? Do you go like frequently? You know your patterns?
Yes.
How often do you go?
Every day.
Bowel every day. Any dizziness? Any when you walk, do you feel dizzy, room spinning, anything like that?
No.
Any numbness in the feet,
No.
arms? Do you notice any memory like lapses, problems, remembering things?
No, I don't. I remember that.
Do you have any difficulties concentrating?
No.
Any trembling and tingling in your extremities?
No.
About your overall skin, any rashes, moles that kind of like looking suspicious, like growing, change of color?
No.
How about the nails? Are they still the same as before? Did you
Yeah.
see anything new?
No, nothing changes.
Okay. How about excessive dryness and itching?
No.
Any drainage from the nipples, any swelling, lumps? Any joint pain, any back pains, neck pain?
No.
Because you're sitting a lot, you have office work.
Yeah, but I don't have any pain.
Mhm. Do you do some stretching activities
No,
when
I
you get
don't
up?
have any pains, no.
That's good. A lot of people only do have with the office work. How about your diabetes and like overall? I know your diabetes is uncomplicated, right? Looking at you, no problems with the skin, no numbness. How about thirst and being thirsty, increased urination, being tired, fatigue? Do you feel it?
In the mornings, because I have diabetes, sometimes I have a dry mouth, which relates to diabetes. Other than that, no, I have nothing else. No other symptoms, no other feelings that I can remember.
It's important to be hydrated. Actually, it's recommended. Besides the diet, we can give you some recommendations later. But being hydrated is important when you have diabetes
Okay.
to keep the sugar under control. How about cold and heat sensitivities? Do you have this?
No, I don't.
Okay. So any swelling, lips, tongue, or
No.
anything occasionally
No.
happen?
Nothing.
Eczema, dermatitis?
No.
Never been diagnosed?
No.
Wonderful. So, as we could see that you have some medications that you brought in, to show us, and let's look closer to it. So first you take aspirin or Ecotrine, 1 tablet, 81 milligrams every day. Do you take them as prescribed, these medications?
Yeah.
And do you know the purpose of them?
Just for prophylactic purposes. There is nothing wrong
I'm sorry.
with that. With taking it's a baby aspirin.
Yes.
It's a low dose aspirin.
It is thinning your blood and prevents you from developing clots and you have certain risks. So you also take atorvastatin 20 milligrams,
Yeah.
1 tablet every day.
Right.
So do you know why you're taking this
It's-
medication?
Cholesterol drug. Taking because I have a little elevated cholesterols. It's like a borderline, so I'm just taking it to get it down.
When those medications prescribed?
This atorvastatin was prescribed last year. The metformin that I have prescribed when I got diabetes about 5 years ago.
5 years ago. Lisinopril and others?
Lisinopril,
Aspirin?
the aspirin was 5 years ago too. Lisinopril, yeah, same thing, 5 years ago.
So I can see that you take metformin,
Right.
1 tablet twice a day, and the tablet is 1000 milligrams.
Yes,
So you take it with the food?
yes, twice a day.
Thank you so much. So lisinopril,
It's for heart. What is
well, it's for the blood pressure.
blood pressure? Yeah.
And it is 10 milligrams daily.
Yeah, it's a small dose. I'm not sure. So doctor told me I have to protect my kidneys, and this is for my kidneys.
How about your blood pressure? Because this medication can actually decrease it. Do you check your blood pressure
My blood
regularly?
pressure is not high. It's not that high. It's sometimes a little higher. Sometimes it's not. But most of the time it's not.
Do you remember when or what was it last time?
The last time it was like 133 over 80 something.
Yes, it's actually important to check to have the blood pressure machine and cuff at home, maybe even two, in case if one is a 40, and check your blood pressure.
Okay.
Because if it's low, it's better to consult the doctor. Maybe take it a little bit later and reconsider the dose of.
Okay.
So this is lisinopril. You take 10 milligrams every day.
Yeah, I have a machine at home. I just don't use much regularly, but maybe I'll try use it like once a week or something. Just to,
And I can see also that you take Mounjaro.
yeah.
Tell me about this medication. How do you administer it?
Yeah, it's injection once a week. Yeah, I got prescribed like a year ago, and I prescribed low dose of 2.5. 2 months ago, the doctor increased. My last time I went to a doctor, like I said, a few months ago, they increased my Mounjaro dose to 5. They told me it would be better to check on my diabetes and having it under control.
So they increase the dose, right?
Yes.
So now it's 5 milligrams pre-filled pens, right?
Yes.
And you inject it
Once a week.
Once a week. On what day of the week?
On Sundays.
Sunday. How do you do it? Like you pinch your
I
skin
just
and you
put it in here.
put it in a subcutaneous, yeah? In a fatty tissue. Okay. So it looks like these medications are all the purpose of them to control your diabetes, weight,
Right.
your blood pressure, your cholesterol.
Right.
So we see that the doctor actually referred you to the lab, and we got the most recent labs, and I could see that they're all pretty much within normal ranges, except your A1C is 7.8. That was the lab was done on May 23, 2025. 7.8. Do you remember how it was before that when you were checking the labs?
I think it's a little higher than that, so it's actually lowered it.
It's a bit lower.
Yeah.
So that means we're on the right track, right?
Yes. And it was that's why the reason they increased the Mounjaro. So hopefully the next lab will show lower numbers there for A1C.
How about your cholesterol? Right now, the total cholesterol is kind of a borderline. It's 199 and it's recommended below 200.
Yeah.
I could see that you're probably approaching that level where you can get concerned. What do you do for that? To control it?
I actually stopped taking atorvastatin. I don't know why, so I'm gonna start taking it again, and it will go down.
Other labs are pretty within normal range. They are good, but if medications are already involved, what can we do besides medications? We can actually emphasize the diet. We can look at your physical activities level to, get better, get all these labs under control, and decrease the risks. Because with the high blood pressure, with the diabetes and high cholesterol, you are at the risk of having heart problems, heart issues, and strokes. So myocardial infarction and strokes. We actually can look at your diet closely and ask about your salt intake. For example, we know that a lot of people eat outside fast food. What can you say about that? Do you eat frequently outside?
No, I don't eat frequently outside. Maybe a couple of times a month. Try not to eat fast food. So I diet in a sense that I don't eat sweets, and I try not to eat a lot of carbs. So I'm taking hard look at my carbs intake to control cholesterol and to control the diabetes part of it.
Mhm. So, you know that a lot of salt is in the processed food. I'm pretty sure they kind of introduce you to a healthy diet. They mentioned what's good for you, what's not, and it's processed food like sausages and fast food. They have a lot of processed and a lot of salt intake. We can send you some information about the healthy diet, consist carb diet that actually covers what foods like high fiber food, low processed food, not refined food. So we can send you that information, kind of a booklet.
Okay.
We can also talk about your sugar intake. I know you're trying to avoid that. You said that you're looking at less sugar food. What kind
Right.
of food are you looking at?
Well, vegetables as well, sugar food. Meat has low sugars in it too.
What kind of, by the way, meat do you eat? Do you eat red meat?
I eat chicken a lot, and red meat sometimes, yeah.
That's good. It's a lean protein, chicken and fish. If you like Armenians eat the red meat, it's recommended less than 70 grams a day of red meat, or less than 500 grams a week.
Okay.
So it's better, yeah. But lean meat as fish and chicken and legumes are the best for your body. Also whole grains and non-starchy veggies like broccoli, spinach is good for diabetic patients. Again, you're not drinking alcohol too much.
No.
Avoiding alcohol is important, and soda drinks, the sugary drinks.
Yeah, I don't drink those. I don't buy Coke. I don't buy, Sprite or whatever. I don't drink sodas.
That's wonderful. That's wonderful. So, when you started taking Mounjaro, how much weight did you lose? Did you have any, success?
Well,
with that?
5 years ago when I started taking it, I lost about 30 pounds.
How was the weight before? How much was it?
I weighed 235, and I got down to 200.
That's a big leap. That's
Yeah.
great. So medication is working.
Now I'm about 206, 210. So
And probably it's with the diet also,
Yeah.
right? Controlling, restricting yourself. That's wonderful. We are on the right track. You know what else can help you with the mood and with cholesterol and glucose? It's exercise. And I would say that 30 minutes a day, most time of the week, it's good, to keep your sugar under control as well. Do you exercise? Do you have time to exercise?
I want to exercise, but no, I don't have time for that. I'll try to make it, but it's hard to get time for exercising.
Would you like us to kind of find the way, like at least like walking? We can actually give you some, information about exercise. At least 30 minutes of cardio, a little bit of heavy lifting for the men is important. Would you like that information?
Yeah, sure.
We can do that. So it's important besides medication to make some lifestyle changes. So do you have any questions about your prescriptions, about if any side effects you're having, any reactions to your medications?
No questions.
Okay. So now when we conclude our health history portion of our visit, thank you for sharing this information with us. We'll review your labs again and medications closely and discuss next steps, and we also can send you some educational handouts regarding diet and exercise for your diabetes management and cholesterol management.
Sure.
Thank you so much for coming today, for helping us
Thank you.
to record and upload this video.
Thank you.